So at my normal doctor's annual visit, I learned through blood work that my sugar levels were too high.
I had gone in for a blood test. I had been hypoglycemic since I was 18, and symptoms, were becoming more apparent, and my blood sugar was high.
I had a routine blood test, but I had actually started to feel neuropathy in the feet first. So it was a late diagnosis, considering that the neuropathy takes a long time to develop.
We're seeing an increase in the incidence of diabetes for two main reasons. The first is the obesity epidemic we're seeing in this country. More and more people are becoming obese or overweight. The second reason is our aging population. More and more people are over the age of 65, and as we get older, you have a higher chances of developing diabetes.
Not everyone who is diabetic has symptoms, which is one of the frustrating challenges of managing diabetes, because patients, rightfully so, question why they need to be treated for a disease which they don't realize that they have. However, there are numerous symptoms of diabetes, and if you have them, you should be checked for it. These include rapid weight loss, insatiable thirst, frequent urination, fatigue, blurred vision, sometimes some trouble thinking. If you have all of those symptoms or any of those symptoms, it's always reasonable to get checked for diabetes because it's very easy to exclude that diagnosis.
I think there are certain stages that you go through with diabetes. First, it's kind of a scary thing, and then a lot of people go through a denial. And then you can either continue to be bummed about it, or you can just decide that you're going to make it better. And I think in reality, it's changed my life for the better. I've been walking anywhere between 4 and 8 miles a day. It certainly changes the way you eat.
We've added exercise to our daily program so that every day we have exercise as well as eat right. We log in every time when we eat something. It's real easy to eat too much if you don't write it down. So that's become a real helpful tool.
People can definitely live well with diabetes. It's really just a matter of maintaining a healthy balance, which includes healthy nutrition habits, getting the appropriate amount of physical activity, and taking your medications as prescribed by your physician.
The first treatment for diabetes at any stage is diet, exercise, and keeping your weight at a normal level. Most people, when they first develop diabetes, will need medications consisting of pills or oral medications. As time goes on, a lot of people do need insulin, but if you watch your diet, get regular exercise, and keep your weight down, you can avoid it in many situations.
Well, I test 4 times a day, and taking shots, that's what do they call that, intensive care.
Most people think back and remember their grandma using a big syringe, a vial, and a big needle to take insulin. Today's insulin are much more effective and safer to use. Today's insulin comes in pens, which are easy dial-up systems where you just dial up how many units of insulin you need. The good news is the needles are extremely small and almost pain-free. Most of my patients tell me they can't even feel it when they give themselves a shot of insulin. Most common misconceptions we hear are that I don't have diabetes in my family, so I'm not going to develop it, or I don't eat much sugar, so I'm not going to get diabetes, or I just have a touch of diabetes, it's not going to hurt me.
The most serious complications of diabetes are retinal damage, which can lead to blindness, kidney damage, which can lead to permanent kidney failure and the need for dialysis, nerve damage, which can lead to decreased sensation, especially in the feet. And decreased sensation in the feet leads to an increased risk of foot injuries and infections. And because high blood sugars decrease your ability to fight off infections, any type of foot infection in a diabetic can be potentially fatal, or can, if not fatal, can lead to months and months of chronic treatment for this infection because of difficulties healing the wound. Also, uncontrolled blood sugars increase the risk of adverse cardiovascular events such as heart attacks and strokes.
And I came within a very short time of losing my foot, and it took some heroic efforts by my cardiologist, and also these, I hope the hyperbaric business winds up taking care of it. But it's the feet can really sneak through on you, and of course your heart. I mean, I've had a bypass and clogged arteries in the legs. All of that stuff is nothing to be afraid of. I mean, the big thing is to bring it up and let your doctor know.
I think one of the most important things that people need to know about diabetes is that it can affect you in so many different ways. That if you do get it under control before you have that need for medication or that need to do drastic changes, you can make small changes that end up making a huge change in the rest of your life.
Probably the biggest thing I would say is exercise, eat right, don't eat junk food. You know, watch your sugar intake, don't smoke. Pay attention. If something doesn't feel right, have it checked out. Don't put it off, you know, for as long as I did.
I think generally it's important for everyone to be aware of their risk, and then once they know their risk, they can go ahead and see their doctor for the appropriate screening test to see whether they do or do not have prediabetes or diabetes. Yes, we do have a tool online that people can use to be screened for diabetes. It's an online risk test, and it can be found at nmdiabetes.org.